look here. Hi, folks. Good afternoon, good evening, good morning. We're here in Switzerland at the EPFL University, which is where the Timeline company was born over 15 years ago. I'm joined here today with Dr. Anurag Singh, who is the Chief Medical Officer here at Timeline. I'm Federico Luna, I'm the Chief Marketing Officer, and we're here to talk to you today about longevity and most importantly, to answer your questions. So thank you to everyone who pre-submitted questions and thank you to everyone who's on the live. Please do make the most of the chat function and ask any questions, and we'll try to get through as many of them as we can. So Timeline, founded here at the EPFL University over 15 years ago. And really, we've been pioneering this longevity and healthy aging space for well over a decade. We've run more clinical studies than most companies or any company in the space. And we're very lucky to have a phenomenal, and not only MD, but Ph.D. with us. And we'll talk more about that in just a sec. Before we get started, a quick disclaimer. While Dr. Singh is a phenomenal doctor, he is not your doctor nor my doctor. So please do make sure that you consult with your healthcare practitioner, doctor, if you have any questions. So with that, let's jump straight in. We start these sessions with a couple of different questions from the audience, but first maybe just Anurag, you've been with Timeline now over a decade. What led you to do an MD and a PhD, and then why are you so excited about this molecule that you've worked so hard on for so many years, Urolithin A?
Sure. So I trained as a medical doctor about 20 plus years back, and in my days of training, I saw a lot of older adults having these chronic conditions that it was probably too late. They were all in their 50s, 60s, 70s, 80s, and they had this whole plethora of symptoms that you could give these pharmacological medicines, but really much of the foundational damage had happened much earlier on in the late 30s, 40s, and 50s, and that's what drove me to studying human aging and longevity for the last 20 plus years now, and more than that, asking the question that there are components in our diet, in the foods we eat, that have these immense health benefits that can boost our cellular health being this foundational pillar of good health and longevity. And so that's the journey that led me to here and discovery of Urolithin A and Mitopure.
Okay, super. So we'll come back to some other questions I have for you, but first I wanted to make sure we're answering some of the questions from the audience here. So we've got a question from Anna here. Is there any data on humans regarding Urolithin A helping people who went through cancer treatment, so post-cancer, especially chemotherapy?
Yeah. So these trials, these randomized placebo-controlled trials are running as we speak, but there is a big evidence body in literature using some preclinical models of different cancers, whether it be ovarian cancer or prostate cancer and colorectal cancer. And all these studies are consistently showing that what happens is that cancer cells hijack the mitochondria of these T cells that are called as what we call as sort of the sentinels of the immune system that basically keep the cancer cells away. And they also inhibit the stem cell potential of these immune cells. And so what is being really highlighted is that Urolithin A harnesses the mitochondria of these T cells that we call cytotoxic T cells, or think of them as elite forces immune cells. And these become much more potent to keep cancer away in the long term. And then there's also these studies that are showing that the immunity, the immune health aspect is also boosted in these particular models.
So I'm seeing a lot of questions around cancer also in the questions that were pre-submitted. I do want to caveat, maybe you could share the caveat here.
Yeah.
As a company, Timeline really focuses on a healthy population, right? We want to keep you healthier for longer. Our products are not designed or intended to prevent nor cure disease, and certainly not cancer.
Yeah.
Maybe just say a couple of words around sort of preclinical, where the evidence is. It's emerging, it's early, but it's promising.
So, when you research a molecule, and especially a molecule like that has 15 years of research behind helping healthy cells become healthier and being better metabolically and having better mitochondria, which is the evidence we have behind Mitopure in general, And then you have these researchers who start finding other new benefits. And in this case, we talked about the benefit. It was a really amazing publication a couple of years back from a group in University of Frankfurt. They looked at colorectal cancer patients, and they found that mitophagy and autophagy were, problematic in the colon of these patients. And then in models, they showed that Urolithin A or Mitopure could kind of re-energize the mitochondria of these T cells to fight the cancer cells. So I wouldn't say it's early stage. I think it's part of what I call translational stage. And so there are a number of randomized clinical trials being conducted both by us and really elite hospitals and research teams around the world. The National Cancer Institute, for example, in the US, is looking at prostate cancer patients who have, before elective surgery, they are taking Mitopure for a number of months, actually 2 months, and trying to see that the recovery post-surgery will be better. So I do believe it has a potential today with the evidence, at least in the post-cancer population, where you have beaten cancer, you're healthy, but now your immune cells, your muscle cells just need that extra help. And so that's where I think that the application is going to be.
And that's what we hope to prove in humans. So
yes, exactly. Absolutely.
Bear with us. What about other areas? There's questions around MCAS, there's questions around joints, muscle, bone, but also questions around brain.
Yeah. So other areas is a lot of research coming. We published with the Scripps Institute in La Jolla a number of years back, where they looked into the joints of a lot of older adults, what's happening with aging in the joints. And what they found was what happens is inflammation and cartilage degeneration. And the third thing they found was mitochondrial autophagy, which is basically mitophagy, was compromised in the joints. And so what was shown, again, the caveat, these are not randomized clinical trials. These were early stage studies done in preclinical models of osteoarthritis or bone degeneration. And what they found was that Urolithin A supplementation in the diet was helping recover, lower pain, lower inflammation, and boost the cartilage regeneration.
Okay, and then there's questions here around potential synergistic effects. Could this potentially, Christopher's asking if this could be synergistic with red light therapy. There's also questions whether there's anything you would recommend to not supplement with while you're taking Mitopure. So today, there are 3 ways to improve mitochondrial health. One, you can make your existing pool of healthy mitochondria. So think about mitochondria as these grids of batteries that are powering each cell in your body. And what happens is that, you can improve their efficiency. So there are nutrients like CoQ10. You talked about red light therapy. Photomodulation is another way. People resort to sauna and things like this to really kind of boost their current pool of mitochondria. Then there's things like NAD supplementation, which allow you to create more near healthy mitochondria. But really the foundation of good mitochondrial health is taking the bad damaged, the sort of zombie mitochondria out. And these zombie mitochondria are really, occupying the real estate in your cells. And unless you clean the waste out, the other therapies that you were talking about or other interventions won't really work optimally. So I believe Mitopure is really the key to taking the trash, the damaged mitochondria out, and then it gives space to boost newer healthy mitochondria. And you can do things like, somebody talked about red light therapy or photomodulation on top. I mean, I think it would be even better, probably. And what about, there's Sharon's asking, any positive impact on stroke survivors in terms of fatigue or mobility?
So you asked also about brain. Stroke is a very sort of, again, linked to our central nervous system kind of etiology, and it's linked to blood flow. So all these are emerging areas of research. Just this last year, there were 3 independent groups, one in the National Institute of Aging, the other in the Buck Institute, and one here in Europe, all independently showing that with the decline in cognitive health, mitophagy is affected, meaning you're starting to get this damaged mitochondria accumulate in your brain cells. And what they found in these, again, early studies was that Mitopure and Urolithin A we're helping in the regeneration capacity of these neuron cells. So potentially there is a lot of promise in this field. I just don't think the randomized trials exist today.
Mm-hmm. Mm-hmm. And I just want to go back to the previous question around synergies, but also people asking, what's the ideal stack? Someone's asking, can this replace a multivitamin? Probiotics, CoQ10. Someone else is asking about Dan saying he's taking Elysium Health. I'm not sure which product you're taking, Dan. I'm assuming it's the NAD, the basis product. What are your thoughts on, you mentioned that, obviously there's this cleaning mechanism, mitophagy, but does Mitopure also have downstream effects on helping create new healthy mitochondria, biogenesis?
So it certainly does that in all our randomized clinical trials, whether it's older adults, whether it's middle-aged 40, 50-year-olds, or now even in some of the new research on really elite athletes, we are seeing that not only does it clean out the waste, which is the process we call mitophagy, but once the waste is clean, it actually initiates mitochondrial biogenesis. Now, what that means in layman language is you're creating newer healthy mitochondria, which are going to produce more energy. And so in many ways, it's kind of replacing what an NAD supplementation is supposed to do. But if you're taking it and you don't want to change it, I think it will work equally well, because now you're kind of, hitting with two darts on the board, right? So I think and you asked about multivitamins and other supplements. I think the advice I give is continue doing what you're doing, but think that Mitopure is that foundational, think about your house. If your foundation is good, then everything on top that you're stacking will be even better. And that's how I see Mitopure, is that it's really a nutrient that is helping nourish the foundation of which is cellular health and mitochondrial health.
So maybe let's just dive deeper into that. That's interesting, this idea of foundational, and why would it make other things work better? I mean, from a biological standpoint.
From a biological standpoint, think of cell metabolism. Okay, so we've just wrapped a study on immune cells, for example, and what we see is that almost every cell type has mitochondria. Now, when you clean the bad, damaged zombie mitochondria out, the cell is metabolically more healthy. Okay, so it's going to absorb other minerals better, and we see that actually when we do experiments in the lab with muscle cells from older adults who are frail. If you put Urolithin A, and after supplementing with Urolithin A, you add things like magnesium, for example, they both work better. So I believe that's how it works, and potentially even things like high protein supplementation can be, even after a certain age, you start getting the effect of high protein supplementation on muscle health and muscle mass boosting. And I think taking Mitopure as a foundation can help alleviate these additional nutrients better.
Mm-hmm. Mm-hmm. So there's some questions around dosing, and some people, I think Rich was saying that he's been a subscriber of Mitopure since May 2024. It looks like he's on the foundational dose, which is 500 milligrams, so 2 capsules per day.
Yeah.
And he's saying that he's not necessarily feeling or experiencing any benefits. Does he increase the dose? What benefits, which doses have we studied, and maybe which benefits, to summarize it, have we seen on the different doses?
So we have very carefully in our randomized clinical trials elucidated the best efficacious dose. So we started with lower doses, for example, 250 milligram, and we went all the way till 2 grams. Now, the way a trialist like me will find the most efficacious dose is we will have a group of individuals in the lowest dose, then we will see the levels in blood that are coming, that are giving a little boost to the Urolithin A, and then we'll keep doubling the dose. So what we found in these randomized placebo-controlled trials was that the 500 milligram and a gram gave the best increases in the levels that you have of Urolithin A circulating in your body. And when we went in and looked at the blood, and we took biopsies to look in the skeletal muscle, for example, what we found was that the mitochondria in the skeletal muscle were basically looking like somebody who had exercised all their lives, or the inflammation levels were radically down. And so that's how we got to. So again, what is the right dose? I think if you're a healthy person who's doing everything right, 500 milligram is that foundational dose. How will you know it's working? Well, it's really then it's a matter of you know, seeing small things like, are you feeling a bit more energy left at the end of the day after a long, tough day? Or when you go to the gym, are you recovering better the next day? I think these are the subtle changes. But if you have things like fatigue issues or you feel your body is inflamed, what I say is that go on a top higher dose of a gram. Do some blood work if you want. So there are things like C-reactive protein. You can look at lymphocyte, circulating lymphocytes, and we know these are things we are picking in our trials. And so that's how I would approach it.
Okay, great. So we've got someone here who's saying, I've been on Mitopure for 5 months. I am a very healthy 89-year-old. Congratulations, amazing. I see some improvement with Mitopure, so I'm continuing to use it. I want to live to 100 and feel the best I can. I have severe evascurosis and nerve damage at L3 and L4. So which prevents me from walking long distances. I wish this nerve pain would go away. Do you think that pain will eventually go away with Mitopure?
Well, first, amazing story, and I do wish and pray that you go on to 100 years and beyond.
Do you think that's our oldest customer, or is it the oldest clinical trial participant, 89?
The oldest clinical trial participant in our studies was a very vibrant 89-year-old lady, much like the question you just read out. And she was a participant in one of our blinded trials. Now, what a blinded trial means is that you don't know whether you're taking the placebo or you're on Mitopure. And she would write to me and the other MD, who was the investigator, that I swear I'm on the active. I have more energy and I'm gardening more, and my petunias are in my garden are looking better. So yes, it's possible even at that age to improve your health span and your mobility. If you have things, like osteoporosis or nerve pain, would Mitopure help? I think it will help in the fact that it will give you energy to move better. It will certainly help that way. Now, is it specific to the effects on nerve pain and brain cells? As I mentioned, we're still studying that.
Yeah. Okay. We have a few people on the chat talking about benefits that they're seeing. We have Gabby saying that she believes that taking Timeline helped her conceive after dealing with secondary fertility for 2 years. What is your opinion on continuing to take it through pregnancy, and also, I guess, in general around fertility? Maybe two-part question.
Yeah. So the science is emerging on this. I think the science on ovarian aging, the science on women's health and men's health aspects of mitochondrial health, and in specific to Mitopure supplementation, is something we are actively studying today. Now, what would I recommend? I think this is really a discussion to be had with your personal doctor and your OBGYN, how this fits within the necessary guidelines and recommendations they're making. That's what I would recommend.
And shifting gears, maybe talking a little bit more about the products. So there's a question from Denise about the capsules versus the powder, but also maybe some of our topical products. What are there differences? Are they equivalent? Can I take 2 capsules and then add the powder if I want a full gram a day?
Yeah, so you could. I mean, so what we have done is we have looked at the clinical efficacy of different products, right? And we have looked at something called as the exposure to Mitopure with each product. So we know that one sachet, the powder sachet and the berry powder, which has 500 milligram dose, is equivalent to taking 2 pills a day. We know that, we have that data. So they both work. Now, if you want to take the higher dose to give yourself that little better boost of energy or to tackle inflammation, you can obviously mix the two. That fits very well with the lifestyle. Now, on the question of how are the topical products different than the oral products, well, they both have carefully calibrated dose of Mitopure that hits the biological efficacy. The oral products are designed to improve whole body cellular health and whole body mitochondrial health. The topical products are really targeting the energy, the cellular energy of your skin cells. And that's what we see is in trials where we deliver the topical products in in middle-aged folks, we see signs of skin aging go down considerably. Things like wrinkles, things like better hydrated skin, and less inflammation in the skin.
Mm-hmm. Mm-hmm. And so, question here from Barbara: are essential fatty acids complementary? And I saw there was a question before around C15 specifically.
Again, goes back to what I said. If the fundamental foundation of your cells, which is mitochondria, are working better, you will absorb a lot of these omega-3s or C15s are absorbed in the cellular membrane. So that's where, with aging, it's well known that these levels decline. And so I think I have a very fundamental philosophy. A healthy mitochondria in your cell is equal to a healthy cell. And I think if your mitochondria, if your engine is working, then your car is running. And so I think that's the analogy. They will all potentially work better.
And Kim is asking, what happens if an older adult takes Mitopure for a year and then stops? Does the improved mitophagy go away? I mean, maybe speak a little bit about exercise potentially as a comparison point.
Yeah, so this is how actually our first research started. I started looking 70-year-olds who were exercising all their adult life, and I compared them to age-matched 70-year-olds who were living a very sedentary lifestyle, had declining muscle function. And we found when we went and did muscle biopsies, hundreds of them, we found that the number one root cause that emerged in the declining muscle health of people who were sedentary was poor mitochondrial health. And so, can somebody take it for a year and after seeing the improvements, then stop it? I think it will be analogous to saying, do exercise, regular exercise, 3 to 5 times weekly for a whole year. And I mean, there is no question asked there that you will have health benefits coming from it. Now, if you stop it, you won't just lose it the next day. I think there will be a period of time where your body will be healthy, and slowly again, you will accumulate the damage. And I see sort of similar analogy with continued use of Mitopure. If you stop it, the health benefits just won't disappear, right? Mm-hmm. They will, as long as your mitochondria, or a pool of healthy mitochondria are functional, you will get the benefits. But it's really the accumulative damage that, again, will set in after you stop using. And you may want to cycle it. I mean, it's perfectly feasible to consider that idea.
You've mentioned inflammation a few times, and I thought it might be worth you saying a couple of words around sort of what part of the inflammation have we researched?
Well, a lot of times I get asked also, what is really inflammation, right? So inflammation is just your immune cells in the body responding to what they consider is danger to your body, right? So inflammation can be triggered by viruses and bacteria. Inflammation can be triggered by foreign objects. But in the context of aging, inflammation is really triggered by these sort of zombie, dead, damaged cells that accumulate over time, as I was mentioning, and that sort of slowly seeps up and causes this, increase in inflammation beyond, as we get 40, 50, 60, you really get this increase. And inflammation, how would you pick it up as a clinician? You would pick it up with blood markers, things like C-reactive protein. You would pick it up as pain. You would pick it up as itchy red skin, for example. Now, what our research is showing is, and this is I would say this is really a very hot emerging area of research in the longevity space. People thought there were these independent hallmarks of aging. Your microbiome goes for a toss, you have inflammation, your mitochondria go for a toss, and then all these epigenetic modulations. I believe inflammation is the centerpiece along with mitochondrial dysfunction of the puzzle. And these two are very closely intricately linked, because damaged mitochondria sort of are leaking and causing this whole body inflammation. And what we see in our recent trial actually is when you take the damaged mitochondria out, when you restore cellular health, you also dampen inflammation. And so I believe this is really sort of a two-pronged solution to improving health span.
And what are your thoughts on autoimmune? There's a few questions on the chat and also in the questions that were pre-submitted.
Yeah, so this is again, there's no randomized clinical trials on multiple sclerosis or, for example, rheumatoid arthritis, but there are many preclinical models that have been studied. Our collaborators or really independent professors in top universities around the world have studied that by improving mitochondrial health, you improve sort of two-pronged, as I mentioned. You dampen the inflammation, but you augment the immune system, and you can control autoimmunity is another form of inflammation where certain parts of your organs start showing up to these immune cells as foreign, and so that's what causes the reaction.
And maybe a little bit just around populations, and so there's a question here: has the benefit of Mitopure been measured in trials? At what ages? 20 to 40, 40 to 60, 60 to 80? Is it a product that's just for my parents? Is it a product that's for you and I? Is it a product for elite athletes?
Yeah. So again, research is two words: re and search. You always have to, start somewhere and keep adding the evidence. So we started with this sort of longevity idea that mitochondrial health was declining as the foundational pillar of as we age, and we found that, and then we found Mitopure that was beautifully re-energizing the mitochondria almost back to the youthful state. And so we started with the older adults. That's where we had the first randomized placebo-controlled trials show that after a month, it's again not a magic pill, so you can't just take it for a few days and expect miracles to happen. After a month, we started seeing that we were nursing these damaged mitochondria back to good health, and we were starting biogenesis, this increase of new healthy mitochondria. We went then into longer trials in older adults, and we went to 40, 50-year-olds, and we started seeing after 2 to 4 months of regular supplementation in randomized placebo-controlled trials, we started seeing about a 10 to 12% increase in leg muscle strength. We started seeing in older adults improvement in muscle endurance and aerobic endurance, and a lowering of inflammation. More recently, us and another top research group has shown that even in elite athletes, where perhaps you can boost muscle and mitochondrial performance beyond a certain extent of, let's say, the human performance limit, things like muscle recovery and muscle damage and inflammation are being helped. So there are different categories of age ranges where we have tested this molecule for benefits.
Men and women?
Most of our trials have a ratio of 2:1 women to men, so 60% roughly women and 40% men in these trials, except the most recent trial done in elite athletes, which was focused on male runners and male weightlifters.
And so Mary's asking, what if someone's in good health, right? Exercising, strength training, and it's interesting that you mentioned these elite athletes. You would assume that these elite athletes are in good health. So why would this product help, and what sort of benefits might someone in good health expect?
Yeah, so most elite athletes, if you look at the body of evidence, they have two things. They overtrain, and they have really inflammation from the damage caused by let's say, the training regimen they have. Yes, their endurance is peak, their mitochondria and performance is at a peak, their strength is at a peak. But what we are seeing is that overtraining, and if you watch these elite runners or athletes over a competitive season, they'll be at their peak at the start and the initial part, and then kind of they'll decline. And the main reason is that overtraining causes mitochondrial dysfunction and inflammation, again, the two fundamentals. And if you look at marathon runners, for example, they have a very shortened health span and lifespan if you look at all the clinical studies done in, for example, marathon runners.
So Catherine's asking, I am 6 years post-TBI and still struggle with the effects on my nervous system. Could this help? 52 years old. My functional neurologist says there isn't enough evidence to recommend at this point.
I would say I agree, because we don't have enough randomized clinical trials done for folks who have traumatic brain injury and are recovering from it. But what is the level of evidence there is that leads to mitochondrial damage in the neuron cells, and we know at least from the early body of evidence that this is helping support some of the muscle, the mitochondrial regeneration and the fatigue and the muscle wasting that happens. So worth a try, but again, the randomized trials need to be done on this topic.
And Bethany is asking, what about for ulcerative colitis or digestive issues? My daughter has been diagnosed with ulcerative colitis, and she's been on Mitopure for 2 months.
Again, clinical trials in progress. There is a number of exciting publications done in the field of inflammatory bowel disease, both at Crohn's and ulcerative colitis. Here I have a sort of a personal story. I also suffer from gut inflammation. I have IBS and things like this. And what I believe, this is a gut microbiome-derived molecule, right? So I believe that actually one of the top professors just wrote to me saying in cohorts of Crohn's and ulcerative colitis folks, they're finding the gut microbiome is so shot that it is not conducive to making urolithin A. And so would this be a trial I would be interested in? And of course, I would love to do this trial, but again, potentially could help, but the data needs to emerge on this topic.
Okay. So we've got a couple of people that are saying that they've asked questions before that seem to have gone unanswered. Sorry about that, folks. We're doing our best to get through all of these. So Tiny Blue Pebble, if you wouldn't mind reposting, we're happy to take that question. And then Judy has asked a couple of questions as well. So it's great to see that Dr. Carmen Sandy, Ph.D., is part of the team mentioned in the Timeline website. Maybe you could say a couple of words just around the work that Professor Sandy has done. And
so Professor Sandy is a very well-respected professor here at the Swiss Institute of Technology. She heads the Brain Mind Institute and really is a pioneer in studying stress and anxiety and what is the root cause of these conditions that lead to augmented, as I mentioned, stress and anxiety. And her research, I would say her really latest research is showing that a lot of it points to mitochondrial abnormalities in certain parts of the brain and in neuron cells. And I don't want to take her thunder away, but she's working on a very big publication on Mitopure that hopefully comes out in the next 5-6 months. But again, in preclinical models of stress and anxiety. And so we just need to translate that moving forward now.
Yeah. Okay. And then what about, there's a question here from someone who is also taking liquid turmeric for inflammation. Can she stop?
Again, reiterating what I said, if you believe it's helping you, don't stop. I truly believe that anything you're doing, do it. But if you add Mitopure to it, I believe you will see sort of an improved augmented response because you're hitting what I call age-associated cellular decline, you will improve it. And once you improve the cellular decline, everything that you're doing will work better because now your cells are healthy and more metabolically wired.
Mm-hmm. Yeah. And Susan's asking, any data in patients with mitochondrial disorders?
Unfortunately not. As Federico pointed out at the start, we study healthy adults in all the randomized trials, and this is a dietary supplement or a nutritional product help to boost human health, but if it was to be studied in a randomized clinical trial for patients with mitochondrial abnormalities or mitochondrial mutations, it would need to be studied as a drug. And so we can't run those clinical studies, but our collaborators, for example, could. So if you know a professor or a clinician working on the topic and they want to study this in a clinical trial that they want to engage on their grant or their own funding, they can write to me.
Mm-hmm. Mm-hmm. And maybe there's a couple of pre-submitted questions as well around GLP-1. What are your thoughts on GLP-1? And can this be taken together with GLP-1?
Yeah, I think these GLP-1 drugs are really one of the big medical breakthroughs, to be honest. They have been around for a long time, surprisingly. People don't know it. And they were developed as anti-diabetic medications because GLP-1 stands for glucagon-like peptide, and this is a peptide made in the body, in fact, a lot by the gut microbiome, and it regulates, glucose levels. It's sort of regulating glucagon, that is the opposite of insulin in our bodies. And so what they discovered about, let's say, 4 years back was that in addition, this was delaying the gastric emptying and lowering the appetite through the appetite reward center in the brain. And that led to what we know it today as Ozempic and Wegovys of the world, which are really anti-obesity drugs. Now, if you look at the data is very, very positive for folks who are obese. But what the danger as a clinician I see is that now these have become lifestyle medications, and the amount of fat you lose, you also lose the almost same amount of muscle. And so if you were a 65-year-old with already declining muscle, you lose the fat, but the moment you stop these drugs, the fat comes back, but the muscle does not. And I think it's really I do see a big role for nutritional therapies. I do see a big role for things like Mitopure in sort of the maintenance phase of these things, where you have seen the effects happening, you've got the benefits out of it, but now you need to do resistant training, you need to do high protein, you need to take your protein, high quality protein supplementation, but you also need to give support to your mitochondria that are very stressed because you've lost so much, your body has lost so much, has shifted its metabolism, and the mitochondria are stressed.
And what are your thoughts on, whether this could improve something like iron absorption, but also Judy is asking, how well healthy is the liver since blood has concentrations of, because UA is heard of as a postbiotic.
Again, we have not studied it in folks who have, for example, fatty liver or things like this, but we do know that in early research done on the molecule by Professor Johan Albrechts here, in models where they give increased fat in the diet, and then they try to see if mitochondrial nutrients such as Mitopure can help recover. They did find protective effects on the liver, and even I'm aware of research done on the kidney, chronic kidney conditions that has potential. But again, we don't have really hardcore clinical data. The hardcore clinical data is really on muscle health, improving the energetic capacity of muscles, improving the strength and decreasing inflammation. I would say this is the three hallmarks we have really nailed in our randomized clinical trials.
Okay, well, with that, folks, we've come to the end of our session. Thank you all for taking the time. Thank you to those who pre-submitted. We will be getting back to you via email if we haven't done so already. Please do make sure, if you don't hear from us, send an email to care@timeline.com. Mention that you joined the live session. We'll make sure to get back to you as soon as we can. But thank you so much, Dr. Singh.
Yeah.
This was great.
Yeah.
And
thank you, everybody.
And we always love to hear from our customers. Let us know if there's specific questions you have. If you'd like us to host future sessions, all of that feedback is welcome. Thanks so much, folks. Have a great end of your day.
Thank you.